week 4 of the baby massage routine. This week we're going to be mainly looking at stretches and just going through some techniques to help the baby with colic and constipation. Starting as always, we are going to be repeating what we learned in week 1, week 2 and week 3. Your mums should have been doing this now for 3 weeks, so they should pretty much have this routine down. But as always, just have a little check. If you think someone's doing something slightly wrong, go round, see how they're doing, show them how to do it, ask them if they have any questions, catch up how their week have all been, and then we can start with the week 4. So stretches should only be performed after a massage because the baby's muscles will be warm and relaxed then. This enables you to stretch them really safely. The stretches will help to develop flexibility, but always remember to use very gentle stretches. We don't want to overstretch these joints and cause injury or harm to the babies. So we'll start with some arm stretches. So we're going to place your thumb in the baby's palm and gently holding the baby's wrists. We're going to stretch their arms out to the side and then gently cross them over, back out and cross again. Now, as always, we're going to repeat 6 times. If babies do not want to bend their arms, they don't want to move them out, obviously we are never going to force a baby to move if they don't want to. But the stretches really help when they're crawling, when they're wriggling around with their development. Pop their arms back down. And the leg stretches. So we're going to be holding the baby's feet and ankles in between our fingers. And we're just going to gently cross their feet over and always give them a little bounce. Move them up towards the abdomen and back down again. And repeat, so cross them over, bring them up, bounce, 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 and back down again. Repeat again, so cross, lift, bounce, 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 and again, cross, lift, bounce, 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 and put them back down again. So we need to be discussing with our mums what baby massage can be really helpful for. So for a baby that has colic, struggles with wind, we would recommend using the abdominal massage from your routine. Now this can be used at any point during the day. This doesn't have to be during their baby massage, especially if they're really fractiously crying, they're really in pain. The abdominal massage routine, the leg stretches as we've just done, and some reverse cycling of the legs can really help just keep things moving. We also find that bouncing a baby, just keep lots of movement can help. Carrying the baby in an upright position. A warm bath to help soothe their pain. And as always, movement is a great way to ease discomfort, such as rocking, using a pushchair or a baby bouncer. If babies are struggling with constipation, the abdominal massage from your routine is great to use. Remembering every time we use it, we do a clockwise routine. Reverse cycling of the baby's legs and the leg stretches could also really help just get some movement in there and keep things going. But just remember to tell your parents at the end of every session if they are struggling with colic, with wind, constipation or any other problems. Whilst massage is a great tool, what they really need to be doing is speaking to their health visitor and speaking to their GP.